Okay, it's 11:15. Let's get started with the Trauma-Informed Community Networks, and we'll turn it over to Rebecca Van Root.
All right, good morning, everybody. I am very excited to be introducing this panel this morning. My name is Rebecca Van Root, and I am the Director of the Department of Social Services for James City County, and I'm also the chair of the Greater Williamsburg Trauma Informed Community Network, and you will hear a little bit more about that during our presentation. I'm going to do a very brief introduction of our panelists so that we can save time to hear all the wonderful information that they are going to share. All of their bios you should have received along with the agenda, so you can certainly feel free to look at those and learn more about all the wonderful work that these panelists have done. So I'm going to just quickly introduce them, and then I'm going to turn it over to Keith Cartwright, who will then give his remarks and then pass it along to the other panelist. We would ask that you would put any questions you have in the chat, and at the end of the panelist remarks, I will go back and share any questions, any comments that you all have. So first up, we have Keith Cartwright, who is the Behavioral Health Wellness Consultant with the Department of Behavioral Health and Developmental Services. We also have Melissa McGinn, who is the chair of the Greater Richmond Trauma Informed Community Network. Nicole Pullen is the executive director of the Family and Children's Trust Fund of Virginia. And then Chidi Jenkins is the advisor on childhood trauma and resiliency in Governor Northam's office. So first, I will turn it over to Keith Cartwright, if he is there and back from his break. And he will start with giving us some remarks. I know I just saw him a minute ago. Of course, he was there, and now he's, of course, this is the Monday of a virtual meeting.
Do you want me to get us started?
Sure, Melissa. I know as soon as you start talking, Keith is going to jump in. Oh no, it looks like he might be having some technical difficulties. He just had to leave. So yes, thank you, Melissa, and then I'm sure he'll join back. So
sure, no problem. Welcome, everybody. Thank you so much for having me. So my name is Melissa McGinn. I serve as the state coordinator for Virginia's Trauma-Informed Community Networks. There are currently 26 of these networks in communities all across Virginia. I'm going to spend my time just kind of giving you a little background about what these networks are, what they're doing, and how to get connected if you're not already. So back in 2012 is when the first of these, we call them TICN, so Trauma-Informed Community Networks. So back in 2012 is when the first of these TICNs got started. The organization that I work for, Greater Richmond SCAN, pulled together a group of professionals in our community to talk about how we could work together to improve practices in a number of the systems that we work with, particularly bringing attention and awareness about the impact of adverse childhood experiences and trauma, and what we knew about the impact of trauma on a child's developing brain, on learning, behavior, and so on. So this kind of group of individuals quickly became a multi-sector network that we called the Greater Richmond Trauma-Informed Community Network. So as I said, that was back in 2012. We, at that time, and continue to do so, follow a collective impact model. So having this shared vision around building a resilient community by really working towards preventing and mitigating the impact of adverse childhood experiences and community trauma. Early on, we spent a lot of time doing as much as we could to spread awareness and training around trauma-informed practices into the various systems that we worked with. we had a number of, we developed a number of committees where we could have very focused conversations on specific systems. So for example, we created a legal and courts committee. We had a schools committee, a healthcare committee, a policy committee, and so on, where we could have very focused conversations and develop specific strategic goals and objectives around improving practices and policies in those various systems. I could spend hours talking about many of the very specific and pretty remarkable changes that have occurred in so many of the organizations that are connected to the TICN. And as I mentioned, with using this collective impact model, this is a multi-sector collaborative. So there are individuals from so many different types of systems represented at the table. Everything from child welfare. I know many of you, I see a lot of familiar names on the call today that are members of TICNs or leaders of TICNs. So from human service officials, legal and courts, schools, healthcare, the aging population, from nonprofit, for-profit, local, state government, and so on. After 2012, within really just a couple years, these networks started kind of popping up in other parts of the state. We started providing kind of technical assistance and support to those networks as they were getting going. We have now, like I said, fast forward to 2021, and there's 26 of these networks in so many different regions across the state. We all kind of have similar key elements that connect us, but the work is also very unique in each of these communities because the needs are so unique in each of these communities. This is very much a grassroots model. Thinking about kind of what Dr. Underwood said, in her conversation earlier, I, can look back over these last 10 years and have learned a lot of lessons where we weren't as inclusive from the beginning. In the early days when we first started these coalitions, there were just a lot of professionals around the table. Even though we were saying we were a trauma-informed community network, there really wasn't community at the table. Fast forward to where we are now, many of the networks that are getting started truly are starting from the community and being led from the community. We continue to really make sure that we are prioritizing equity. Again, earlier in the, in the beginning stages, when we would talk about ACEs and trauma and community trauma, there was so much of a focus on, the trauma that impacts a family or a family system. But again, we, didn't do as good of a job focusing on the impact of racial trauma and systemic and historical trauma, which we are doing more so now than they were in the beginning. So over the years, we have partnered closely with Voices for Virginia's Children so that we could also work to try to change policies within kind of our various systems. In 2017, we worked with them to draft and ultimately get passed a resolution that recognized trauma-informed community networks across the state and as a best practice towards preventing and mitigating ACEs. That also laid some of the groundwork for future work. Since 2017, every year there has been, with the help of Voices who've taken the lead in organizing this, there's been a trauma-informed advocacy day at the General Assembly where we have pulled individuals from across the state who are participants in these networks to come to Richmond to have meetings with legislators to advocate for different policies that impact the well-being of children and families. Even last year, we still did it and it was just virtual. But there's been so much work happening kind of in these communities and specifically the organizations within these communities. As I said, at the beginning, there are 26 networks across the state and continuing to grow. There's 3 that are currently in development. The conveners of these networks come together for, we call the Virginia TICN meeting every other month, where we come together to use one another for support, share resources, share new and creative practice changes that have occurred in different organizations or pieces of our community, to really learn from one another and stay connected. We also have many state partners who have continued to come and show up and support the work over these years. I think something that's very unique to Virginia is this collaborative nature of these networks. All across the United States, there are similar types of, trauma-informed or resilience coalitions, but the fact that there's this collaborative element amongst all these 26 networks using one another for support is very unique to Virginia, and our connection to local and state government and policy work. There's a significant momentum that is occurring, and it's continuing to grow. As I said, I know that there's a number of you on the call today that are part of a trauma-informed community network in your region. If you are not, you should be. Everybody really needs to be involved. I'm going to share some of my information in a few minutes in the chat. So you can find out if if you don't have a TICN that's in your region, or you're curious if there is one, I'm happy to get you that information or to work with you on how to get one started. One of our most strongest supporters from way back in the beginning has been the Family and Children's Trust Fund. They've been with us every step of the way from the very beginning. Nicole Poulin has been really one of our biggest champions in this work, and we really couldn't have done a lot of this work and been as successful without her and the support of the Family and Children's Trust Fund. So I really want to thank Nicole, and also go ahead and pause now, because I could really talk about this for hours. And I'm going to toss it to Nicole, and I encourage you, if you have any specific questions about practice changes or things happening in your community, please put it in the chat, and we'd be happy to talk to you once we've finished presenting.
And I'm going to toss it to Keith because Keith does a phenomenal job of really talking about why this is such important work. If that's all right, Keith. Since you're
Absolutely.
back.
Can everybody see me and hear me? It would not be a day in my life if there were not technical difficulties, but I'm grateful for teammates who jumped in and kind of worked with our out of order. So thank you, Melissa. And one of the questions that may come up listening to Melissa talk about trauma and trauma-informed care and networks is a question I get asked a lot as I go around the state and talk about trauma, and that is, what is trauma? And bad news is I am not going to leave here today giving you a working definition, because if you talk to 100 different people, you're going to get 100 different definitions. My goal is to help you understand a concept more than a definition. And it's a really important concept, one I can talk for hours about, but I'm going to try to squeeze it in about 10 minutes. So the main thing I want you to understand about trauma is not an event. It is actually our response to an event. And when we understand that, we start to understand that what may be traumatic for one person in terms of an event may not be traumatic to somebody else. And that's really important, because we can get quick to judge somebody's trauma based on the event. And what I want to do is spend a few minutes helping you understand how we get to this place where we respond differently to an event that maybe somebody else does. So the biggest piece I need you to understand about this is that what determines that is largely influenced by what happens in the earliest days of our life. And what I'm about to talk to you now, I sometimes joke, but I'm really not joking, that I've got 12 and 14-year-old sons. And I always say nobody should have ever let me have those boys without talking to me and teaching me what I'm briefly going to squeeze in to you here. And that is stepping back and taking a look at how that young baby brain develops. When I do presentations, I always have a picture of my oldest 14-year-old now in an incubator. There's this powerful moment. Is the first picture of us together. He's in an incubator and my hand is reaching into that incubator. His eyes are absolutely fixated on me. And I always tell people that was like this spiritual moment, this philosophical moment, this first experience of love moment. But now I know there was something really scientific happening in that moment, because we all come into this world getting wired for one common purpose. All of us sitting here today, our bodies are wired for one common purpose, and our brain is the command center for this purpose, and that is to keep us alive. We're all out there doing really complex things today. We're in this conference, we're coming at it from a lot of different places, but our bodies are all working for one thing for all of us. That's to keep us alive. So in the earliest days of our life, when a new baby comes into the world without a thinking brain, it's almost entirely an instinctual brain. No baby comes into the world saying, "I'm hungry, where's mom? It's time to eat." No baby comes into the world not feeling well and trying to kind of diagnose what they need. It's all instinct. And so they cry out instinctually because they do not feel safe. In the earliest days of their life, they're crying out because they don't feel safe. Now, and this is critical, what determines how safe that baby who is only hours old feels in that moment is in response to, does somebody show up and help me feel safe? Does somebody show up and help take care of me? A baby's worldview of relationships and worldview of love starts in those moments. And that's how the brain starts to develop. The earliest part of the brain is what we call this reptilian brain, and I don't have enough time to get all into it, but again, it's this part of the brain we all come into the world with. It's basically instinct, but as the brain develops, it starts to wire and depend on relationships for safety. And it's through those relationships, then the brain starts to develop these, in partnership with that relationship, these higher level abilities and capacities to think, these higher level abilities and capacities to kind of find what's unsafe and safe in a more rational and logical sort of way. But that's on down the road. That's where my 14-year-old baby Elliot in the incubator is today. But the brain just didn't develop linearly and along a timeline. It developed in partnership with a relationship. Now, here's the critical piece. And this is why I call this the science of empathy. And that's really, I have one goal for all of you today, and that's, to me, is trauma-informed care is developing a more empathetic society. This process I just talked about, and I could talk about for hours about how the brain develops. Our brains do not develop in the same environments. So a baby's brain that is developing in a safe environment is a brain that's developing in a space where people are constantly showing up, helping that baby understand you're safe, you're protected. So that brain doesn't develop with distrust of adults. It doesn't develop with a sense of fear and a constant sort of looking out for the next source of trouble. But a baby's brain who develops in a chaotic environment where there's a lot of violence, where there may be a lot of poverty, where there may be a mother who doesn't have access to health care, who's constantly worried, who has constant stress in her own life, who does not have the capacities for a lot of these reasons to bring that love and nurture to a baby, even though she wants to, just as badly as the mom who's in that safe environment. So this baby's brain starts to develop because it has to, right? I'm going to go back. The brain is the command center for keeping us alive. So what it takes to wire to be alive in a safe environment looks very different in the brain that's getting wired to survive in a more chaotic environment. And so the people we see today, the people we interact with today, who may be challenging to us to interact with, too often we're quick to say that's a difficult person to get along with, and we leave it at that. And it's sort of a judgmental way. When in reality, what we should be at least curious about is what happened to this person along the way that has led to the choices they're making today, the way they're behaving today. Because here's the deal. Again, I'm going to go back. Our brains are wired to thrive in the environments that we grew up in. They were not wired to thrive in a lot of the future settings in life. A young person who's grown up in a volatile environment that has to be wired to survive, and volatility is completely in a foreign country when they step foot into an elementary school classroom for the first time. A classroom that has neat, orderly rows, where there's a calm teacher saying, everybody sit down, please, raise your hand if you want to talk. A child is not, who grew up in a volatile environment, whose brain developed absolutely perfectly to survive in that environment, who doesn't sit and behave well in a classroom, and we too often say they've got something wrong with their brain. That's not the case. Their brain wired as perfectly for their environment that they were raising in as the kid who has a brain that was wired in a safe environment. Now, here's the good news and the bad news. And we'll start with the bad news. So much of what happens in our childhood influences who we are today. So much of this environment we were raised in is the wiring we take forward today. So that's the bad news in terms of how much wiring takes place and just how much what happens in the earliest days of our life is weighted in the earliest days. And if you want to know really the impact of that, a newborn baby, when they come out of the womb, is developing about 20 million new brain neurons per second. Keith here today, who's slightly older than that newborn infant, will be lucky if I develop 700 the whole day. I just tell you that to say how important what's happening in the earliest days of our life is. And that's why I joke and say somebody should have made me know the importance of me being intentional with those little guys I had way back then. Now, here's the good news. The bad news is the good news also. We know what happens in the earliest days of our life has the most impact on who we become. So if we know that, we know where to start pouring resources. We know where to start trying to impact lives in the beginning, because what happens in the earliest days of our life is the best predictor we have of what's going to happen in the latest days of our life. So when I start talking about what is trauma-informed care, and again, you can go somewhere and get a million definitions. To me, trauma-informed care starts with this idea, no matter what sector we're working in, whether it's in my family, whether it's with my neighbors, whether it's in my office, whether it's in a classroom, it starts with this idea that how folks are behaving in those environments is largely influenced by what happened to them in the earliest days of their life. And the interactions we're having with people, we're best served at least starting with a curiosity. I tell people all the time, I no longer am terribly curious about who people are. I'm mostly curious about where they've been in life, because if you understand that, what people have been through, where they've been, you start to understand how they've been wired. You start to understand literally the biology of that human being. And it triggers, I hope, it sure has in me, a lot more leaning towards compassion, a lot more leaning towards empathy. And you know what? If we just started that in all of our interactions with one another, with a sense of curiosity and with a sense of empathy, to me that is trauma-informed care. More and more every day, I tell folks, you know, we really ought to treat each other like we've all experienced some sort of trauma in our life, because the reality is most of us have. And if that was just a starting place, then we'd all be a lot healthier. we'd all be a lot better together. So that's my 10-minute version of what is trauma and what is trauma-informed care. And again, this is a real challenge to me because last week I did this for 2.5 days. So you just got it condensed to 10 minutes, but I'm excited to then turn it over to Nicole, who I will echo what Melissa said. I'm just going to say all three of these folks that I'm here with today, they come at this with a heart and a passion that makes me glad that I'm finally kind of in this work in the work that I do. So, and it's these three women that I get the pleasure to do this with today that make it a heart issue and make me really passionate about it. So Nicole, I'm going to hand it to you.
Thanks, Keith. Although I have to say it's always challenging to go after Keith because he's such a great presenter and it's hard to hold people with that, but I'm going to give it a shot. So I feel like I need to, on behalf of the Board of Trustees for FACT, give you just a very quick history of the Family and Children's Trust in Virginia, just because a lot of folks aren't really familiar with it. So it was created in 1986. This is our 35th anniversary year. And it was created in Virginia as part of a national movement that was happening at the time to set up trust funds to support efforts to prevent child abuse and neglect. Because at that time, believe it or not, there really wasn't any funding to support prevention of child abuse and neglect. So states set up these trust funds that were a combination often of state and federal and local funding to support those efforts. Virginia is different in a variety of ways. And to that end, Virginia established our trust fund as a family and children's trust. So not solely focused on child abuse prevention, but also on family violence across the lifespan. So our focus is on preventing and treating family violence for children, domestic violence, sexual assault, and older adults. So it's a very broad scope that we are tasked with in Virginia. The structure of FACT is that we are overseen by a gubernatorial appointed board of trustees. The commissioner for the Department of Social Services is a permanent member of the FACT Board of Trustees. And the administrative support, the person who carries out the wishes of the board, that would be my position, is supported by the Department of Social Services. So it's kind of a hodgepodge of entities working together. So we are staffed, we're a small but mighty staff, we like to say. We are me, and we have a part-time research associate who is phenomenal, Taylor Davis. So a few years ago, the board, and I really appreciate the kind words that Keith and Melissa have said about me, but really I don't get the credit for this because it was the FACT Board of Trustees that really moved the needle on this in Virginia before I was even hired into this position. So in 2012, when SCAN of Greater Richmond really started looking at this community impact model and kind of, doing that work, beginning to start that work, FACT, the board became interested in this and learned a lot more about kind of the whole issue of trauma-informed care, and very wisely, I think, made the connection between the focus of FACT and this work in trauma across the lifespan. Because when you think about it, it really reaches all angles of the spectrum of prevention, right? So primary prevention, secondary prevention, and then tertiary prevention. So that would be like preventing things from happening, but then also helping them stop and preventing it from happening again. So this is a really kind of wonderful way for FACT to kind of focus its efforts on this well-established and yet still emerging work around brain science and trauma, and also support really community efforts, because that's another kind of philosophy or purpose of FACT, is really to support what's happening at the community level. And so to that end, they began funding 2 TICNs in 2012, and that has grown into supporting 7 of those TICNs. And it's really kind of a heavy lift because the funding that FACT receives is very marginal. All of the funding is through donations and our license plate program. So just call out if you don't have a Kids First license plate, you might want to get one because that money goes to support this work. But in addition to supporting these networks with some grant funding, we also have taken a higher level look at some of those environmental factors and macro societal factors that Keith was talking about with regard to, I don't think it takes somebody with a high level of sophistication to understand that, the circumstances people live in and grow up in affect who they are. And those circumstances aren't influenced by individual types of relationships, but also societal types of relationships. And, I think earlier when I heard Dr. Underwood say that the systems aren't broken, they function just as how they're supposed to. That's exactly, I think, in line with the work that we're trying to do. So recently we started, we've kind of done 2 issue brief series, which is really the activities related to that is when we take these issues and we do like a deep research dive in them, and then we create these issue briefs that can be used to educate and provide guidance for, a variety of different topics. We did an issue brief series on specific trauma-informed care strategies within different professional venues. So we did one for schools, so trauma-informed strategies that have some evidence and science in impacting children and development in schools, and then also in homeless intervention services, and then in home visiting programs or in-home care for older adults. So it's kind of across the lifespan, different strategies, professional strategies that are impactful for those populations. And then our current issue brief series that we're focused on is much more of those macro level, environmental level types of things. So we have a series right now on systems of social injustice and how they impact trauma. So the first in that series was on poverty and how that impacts individuals and families and communities. And then the second in that was on racism and systems of racism. We're currently working on a brief on gender inequality and how that impacts women specifically, but then we're also going to have a separate issue brief on LGBTQ+ populations. So we're really trying to bridge the, awareness around, what happens at the policy macro level and how that directly impacts individuals and families. Because I think that that's a challenging kind of a perspective to help educate folks on. And so we are up to the task of doing that and working diligently as we can. I will make sure that you all receive the link to the issue briefs. Unfortunately, I just learned that our website is down right now, but it will be up later today. So I will make sure that that information gets out to everyone. And I'm going to pass it on to Chidi now. Thanks.
Thank you. Can you hear me? All right, super. Thank you, Nicole. I don't like bringing up the rear, but certainly these 3 folks have, I think, set the tone and the understanding for everyone who is listening about trauma and traumatic experiences. More importantly, the impact that that has on an individual and a community over the course of a lifetime when you really start to dig into those early years and experiences. In addition, I think there is more discussion that we can have about resilience, and that being the counter to trauma and traumatic experiences, and how all of us, no matter what has happened to us, have been able to overcome what has happened to us. So I am Chidi Jenkins, and I, as was introduced, serve as advisor on childhood trauma and resiliency in Governor Northam's office. I am housed within the Secretary of Health and Human Resources office currently, and really come to this role by way of education. So I was a classroom teacher. I taught elementary school, and there was a point around the time I really was a few years into doing a lot of mindfulness work with my students and yoga as part of our regular brain breaks in classroom, that I realized there's a bigger picture to this. It's not just good for my kids. I think there's a lot more happening than just a regular scheduled brain break. And so that is how I came into sort of understanding a little bit more about the brain science behind trauma, the practices. And then when I moved out of the classroom, my understanding grew around the importance of policy change and practice change across systems, not within education. So to share a little bit about my role and about Governor Northam and the First Lady and a lot of their priorities, we have a children's cabinet here in Virginia. There are many all across the country, but ours here in the Commonwealth really was prioritized around the efforts were prioritized around the things that the First Lady and the Governor felt were very important. So obviously, as a pediatric neurologist in particular, the First Lady also as an educator and a former occupational therapist, there was significant understanding about the importance of those early years, significant understanding about the importance of wrapping around not only children, but their home environments and their caregivers and their families. And so they put a few things at the forefront of the efforts of this cabinet, and that was food security and early childhood and early learning opportunities and early childhood education. Both of those things also had an element to them that were around reducing food insecurity for mothers and for parents and parenting people, as well as when it comes to early learning opportunities, that sort of care and early learning sort of home visiting type aspect and support for mothers and parenting people early on in those early years, right? So it wasn't just, hey, let's plug a bunch of money into early childhood education centers. There was a much more holistic view of it. The Children's Cabinet also has focused early on in the administration on student safety. Obviously, we all remember, and still to this day, unfortunately, we are reminded of the need for physical safety measures in response to not only in-school violence, but just in general, the mental health and wellness of our young people when they are in school and on campus. And then, of course, trauma-informed care is another focus of this Children's Cabinet. The cabinet is made up of the First Lady and 4 cabinet secretaries: Secretary of Agriculture, Health, Education, and Public Safety. So you can see how they all kind of have work and policy and system areas that revolve around those 4 areas. And so really where I come in is to staff the Trauma-Informed Care Working Group and the many stakeholders, some of whom are here today, who really have an eye and their hand on the pulse of community-based efforts to prevent and mitigate trauma, and then elevate through that sort of system to not only the First Lady and the Governor, but then, more widespread across our state agencies, the importance of trauma awareness, the importance of practice and policy change, and where some of our legislative and budget priorities should lie going forward. I think it's really important that I highlight the fact that what happens in community is, one, so critical and so important. And we recognize the role that trauma-informed community networks play. We also recognize the fact that trauma-informed care, empathy-based systems, understanding where someone has come from, what has happened to them. This is not novel and it's not something new. It has been happening for a very long time. It just maybe needs to happen more regularly and amongst people who never understood the long-term impact that it is, and the idea that we can re-traumatize by not addressing it, right? And so where I have come from in my role is really in saying, we in state government, whether it is at the Department of Social Services, the Department of Behavioral Health, Department of Juvenile Justice, Department of Criminal Justice Systems, Department of Ed, need to also walk and model the way that we are saying and the way that we understand we should be responding in our systems. And so through policy change, through investment, through public awareness, how can we do our part in making sure that the Commonwealth is not only trauma informed, but actively working to make our communities and systems more resilient? And so the hope is that that trickle down effect will make it all the way down to the thousands of state employees who deal with children and families and individuals who have had these experiences every day, that it will really pivot the way that we talk about people, the way that we name them. There is language that we would have used 5 years ago that we would never use to describe an individual today. And part of that is about awareness, part of that is about empathy, and most importantly, it's about respect. And so I think that question came up about, like, where do we go next, and how do we keep this up? And I think it's about learning and continuously changing to understand that those early days, those early years are important, but we have to continue to make sure that we are supportive of people across the lifespan, no matter what happened early on. So I feel sometimes that my work is the really boring work with policy, but excited to be a part of this conversation and be with these amazing people and answer any questions that I can for those who are here listening to us.
Wow. Well, I just want to say, first of all, thank you to all of the panelists. I was very honored that I got to select what I consider the cream of the crop when it comes to talking about this important issue, and also talking about it from different perspectives. When we were thinking about how to present this to all of you, this is a group of leaders in human service organizations. And one thing I felt it was important, and I think all of you touched on this, is that it's a grassroots movement. It's also, though, a movement that we need to sustain and that we need to, in a lot of ways, formalize so that we can do the important systems work that really makes the difference and can counteract some of that collective trauma that we all know or need to admit that does exist. So if any of you, maybe want to touch on this about, leaders, and if there's any particular strategies or any tips as to how we can embed this work or trauma in the larger work that we do.
I can even just talk about even just myself as a leader of a program, right? Like, so I just kind of operate kind of from that space that Keith was talking about, just kind of always recognizing that we all carry stuff like into every space, right? We all have these, people use the metaphor, invisible backpacks or invisible bags that we're carrying, right? That was kind of bringing this into every space. And I kind of keep that kind of in the forefront. And I'm always also trying to recognize that much of the work that we do sometimes has the potential to traumatize or re-traumatize. And whenever possible, how can I make sure that I'm not adding additional stress, or how am I not adding additional trauma whenever possible? Knowing that, thinking about, those that are on this call today, you work in systems where some of the practices that you have to do because of safety, sometimes for children, are going to traumatize. But so, for example, if you're doing a removal, right? There's times when you have to remove a child from a home, and that is the right thing to do in that moment. But you also know that that has the potential, and it is traumatizing or to re-traumatize. So in that moment, what can we do to potentially lessen the stress on that child, or lessen the stress on the family, lessen the stress on that coworker, on that worker? Because again, they're all going to be carrying this stuff. I operate also from using a reflective supervision model. So when I'm providing support to my staff who are in the field doing very hard things, I'm making sure that I'm providing opportunities for consistent supervision or debriefing, so that I can, again, recognize that, the importance of their own wellness, so that they can be able to do this work. And again, you can kind of go on and on and on, but having that mindset of just how am I just not making sure that I'm not adding additional stress whenever possible, and recognizing those invisible bags that everyone carries.
And I'm going to chime in a little bit too, and that is I'm going to talk about it on two ends. And Chidi talked about something, and she started to go down a road we would have gone down if we had more time. But this idea of resilience, a lot of times we have this conversation and people leave hopeless. But one of the things that I think is important in understanding the concept of trauma, it's not the event, it's the experience. And now we've talked about the importance of relationships to the experience. And so with that, I always tell folks, sort of the curse is the cure, right? We talked about trauma. What's traumatic for a young person is largely in response to the kind of care or the kind of relationship they have in that experience. And so something's traumatic if somebody doesn't have a healthy relationship at that critical time. Well, resilience in the aftermath of that, years down the road, is the same thing. It's a meaningful relationship at a critical time in that person's life. And I say that, resilience is a somebody. If any of you sitting here right now got a phone call and it was with bad news, your first instinct would be a somebody. I'm going to call my spouse. I'm going to call my friend. I'm going to call somebody. The person who has that somebody is probably going to be healthier in the aftermath of that bad news than the person who doesn't have it. So that's sort of this resilient thing. I think that's a conversation that's important when we're talking about how do we staff classrooms. When we start talking about the most important thing in a classroom is relationship, because it is. Nobody's going to learn anything outside of a meaningful relationship. I say all the time, we will go into a school system we will know it's trauma informed when we do not recognize the staffing pattern in that school. And I'm not sitting here making recommendations for a bunch of changes. I'm just talking about, if you believe what I believe, that relationships are key. It's a monumental ask when we ask one person to have relationships with upwards of 25 young people in a classroom that, oh, by the way, over half of them have experienced some form of adversity or trauma in their life, conservatively guessing. Then the other piece so that's sort of on this end. More and more, though, my work is advocating that we start moving attention to the front end. And trauma informed to me isn't no longer, it's not about us having all the answers. It's about us getting good at asking the right questions and to the right people. Too often, we've left the important people out of the conversations as we've come in and given them solutions. And so I give this example now all the time. If you believe in what I just talked about, the importance of what's happening in the earliest seconds of a young person's life, and the science supports it. Our conversations more and more need to be, and I give this example of, there's a new mama and a new baby in this house. And too often we're outside talking amongst ourselves at a conference room table about what needs to happen in there, without ever going in and asking the mother, what do you need to feel safe enough to have a nurturing, loving relationship with that baby whose future depends on you being able to have it right now? And suddenly we're having conversations that look at access to healthcare a little bit differently, because a mother who's sitting there with her baby and has no idea if she's going to be able to take care of that baby if it's sick is nervous and stressful. And that young baby Babies are forming their earliest moments of empathy with their mother. They want to see the mother smile because when the mother is smiling, they feel at ease. They feel safe. They feel like they're going to survive. A mother who is worried about access to health care, who is worried about whether I'm going to be able to put food on the table. These are all conversations a community needs to be having, looking into that room with a new mama, a new baby. And I don't think we frame enough of our community systems conversations around that idea. And I think it's because we don't often, like me, a new dad, didn't look back and fully understand just how critical. There's research today that says the first 2 months are as critical as any period in life that comes after that. And so I think the research is telling us we have to get more, at least interested and curious and mindful about where resources are going, where our conversations are going. So I'll shut up there because I could go on too long.
I just wanted to jump in and just reiterate what some of the other wonderful folks on this panel have said. But I think a lot of what I'm struck with in this work is what Chidi said around like this is not necessarily new practice for a lot of us. It's just kind of reframing it. And I think also lifting up the significance of it. So it's not just a charitable thing, right? To be kind and empathetic to people. It goes way beyond that because our greatest resource as a country globally is how we are raising our children and how we are treating our people and how we support people in their lives. And that maximizes output, right, for society. It's a really cost-effective thing to invest in. And so I think that part of what I get excited about with this work is when we do talk about how those macro level things, you know, and it isn't all doom and gloom. We know there's strong science about how to correct this ship, you know. I just as a side note, but as an example of this topic, I used to work for Medicaid, and one of the issues that is interesting in this country and different than many other countries is the way we treat dental care in this country versus other forms of healthcare, right? It's almost like a luxury item, right? Dental care is almost like cosmetic surgery as far as like how we pay for it, how we support people's access to it. It's really not seen as a critical part of healthcare. But the science in healthcare knows that dental care is really important. And I used to say, when you talk about this, if you're a parent, anybody who's ever been a parent or spent any amount of time with a toddler, try parenting a toddler if you have an abscessed tooth that you have no hope of being seen for. Just that tiny example in my mind presents a wonderful example of how critical these types of foundational support are in helping people move beyond this trauma. And I think that it also speaks to, you know, Maya Angelou, one of my favorite quotes is Maya Angelou's quote about people won't remember what you said or what you did, but they'll always remember how you made them feel. I think that we need to be thinking about that in all of our policy development, in our individual interactions with one another, but also in how policy is affecting people. And that's not kind of an ooey gooey, you know, everybody be nice, kumbaya kind of thing. That's the way you get people to respond and to really, as I said, maximize output as a nation. You know, we're wasting resources by not supporting families in this way. So it's exciting work, but I absolutely agree that this is not a dooms and gloom situation, but I do think it's worth presenting this information because we haven't necessarily done a very good job in this country of talking about kind of how we got to where we are and how important it is to kind of look at, examine, and understand and recognize the science behind how that's affecting us at all different levels.
I'll relinquish the floor because that I think is such a great way to answer that first question. So I will let us move on to what is in the chat or maybe your next question too.
Well, thank you. And I do appreciate, Chidi, that you put a resource in the chat. And I like the way you framed it as intentional change. because I think all of us, personally, I know we should walk away from this going, I understand the impact and the need to change, but it's the intentional change part. And I think that's what Dr. Underwood was talking about as being change agents. You have to decide for yourself and also as a member of your organization that you want to do that intentional change, but it's not a hopeless situation. There's so many resources out there. And I think for me and why I thought it was important to highlight the TICNs is that that's really where some of the relationships can come in too, to help you build resiliency as a community. You have this network of people from multiple organizations, from multiple different perspectives to say, how can we intentionally change our community around this notion of being trauma informed? So one last question that I'll pose is, and this is going to be a tough one, but I think something that I think we all need to talk about is, how do you know when you're making a difference? I think we all know outcomes and evaluations, especially when it comes to funding and things like that, are important. And so if all of you, or any of you who want to speak, just have maybe a couple of quick things about how do you know when that trickle down has happened? When you say, okay, I see this change happening and I know that if the intentional change is making a difference.
So there's always kind of the qualitative and quantitative changes, right? So quantitative changes, when you start talking about like numbers and moving the needles on numbers and like actual behavior, significant changes, that takes a long time to get to. I mean, that really takes a lot of effort and time to get to, depending on the strategies that you're implementing. But qualitative changes, I think, is kind of where we are in a lot of this work right now. And I think that more has to do with things like, how are people talking to one another? How are resources being connected? How are we in our daily interactions feeling like we have kind of a new set of tools to deal with sometimes folks that can be a little challenging in our work? Like, those types of things are not nothing. And I think it's important that we do consider kind of looking at a lot of those more incremental qualitative types of movements around this work, in addition to the larger scale, because we also know there's science around like changing strategies in education, about how to get better outcomes for how kids learn better, how they learn math better, how they graduation rates, all of those qualitative things. There's science on right now, and that's building. But I think we have to do both at the same time.
Yeah, I'll pipe in here and follow that up, because I think Nicole brings up a good point about the numbers. And ultimately, at least from a state's perspective, a lot of times there wants to be this very, significant conclusion that says, well, if we consider this, if we make changes, what is our return on investment? Fortunately or unfortunately. And to me, at least, and I think for many who understand and value this work, you may not see a return on investment in a traditional way, but you do need to be intentional about where you're looking. And over the course of the long term, you will see changes in number of youth in juvenile justice, graduation rates, early childhood school readiness, right? Number of household income, for example, may rise. Maternal deaths and infant mortality will decrease, right? Access to, homelessness numbers may go down. All of these things, when we build the resilience of individuals, families, and communities, what numbers do we see go down that we want to see go down, and what numbers show that we are rising, that we are thriving? And I think that is the return on investment that is so macro that a lot of folks can't quite wrap their brain around it. But then when you look at the cost of how much it will run us as a society to not do it, right? I think Tennessee found that it was like $2 billion in healthcare costs alone to not address childhood trauma and adverse childhood experiences. And you go, well, gosh, I mean, what is a few $1,000,000 to invest in school counselors if we can prevent, fill in the blank. I think the flip side of that, when we're not talking about the economic, is also what Nicole said about what do we hear and what do we see. And I think like the youngest generation is really great about that. We can hear them using language that we really, I think, started when they were very young. Like, tell me how you feel about that. How are you going to respond? I'm giving you choice here in your two options. And you hear young people who are saying things like, I'm not okay today. That doesn't mean I have to change my behavior as the human services individual or provider who's in front of them. I may not need to do anything except say, thank you for sharing. Can I be of help? And that in and of itself is a small but massive change in the way that our society is moving in a good and positive, more resilient direction. So for me, that would be my answer to the whole, numbers and data and how do we know that there's things actually making change.
I would also encourage you, on the call today, I think both Nicole and Chidi brought up some really good points. And I think there, on one hand, there is, when we think about like the quantitative and then, we would hopefully see, less, disruptive placements or maybe less, office referrals if we're talking about a school. And but it's so important, even when you're in your staff meetings, your team meetings, things like that, to create those opportunities for just those brief moments for people to talk about like how they've, slightly changed their practice since kind of using this trauma-informed lens. A lot of where that change starts to happen is that ongoing dosing of kind of this information and talking about what this can look like in practice. So creating those opportunities, at the start of a meeting or just naming it when you see it, to really highlight what this looks like in practice, I think can really help bring this alive for people who still sometimes see this as, just really kind of being disconnected from how this really changes my day-to-day interactions with my clients or my individual practice with those I'm serving. So any opportunity that you can provide space for that, even if it's just 5-10 minutes or naming it when you see it, is really critical.
And I just want to add real quick, Rebecca, to me, and to this is powerful. My life is in substance abuse prevention, although I never talk about a substance anymore. This past year, the state allocated resources, money, for substance abuse prevention in the state for the first time in the history of the state. That's not a critique on the state. That's a critique on us never being good at telling the right story around substance use. We now know substance use and abuse and addictions are actually people's solutions to the problems that they are having. We're getting much better now at talking about people's problems. And because we got better at the narrative, suddenly we have resources to start doing that job better. And then the other strong piece of evidence for me, given that same context, I'm sitting here today with Chidi and Melissa and Nicole and Rebecca having this shared conversation that was unheard of just 3 years ago before we started rallying around this one common issue. And I experience this almost weekly now, where I'm in these conversations with people I never would have been in and shared conversation. It's all because I think we're having the right conversations for the first time.
So I do know that we could talk about this for a really long time, and I want to honor and respect the time that we're given as our next presentation is at 1 o'clock. And I appreciate there was a question in the chat about our TICians working on workplaces, clients, communities, or all three. And as Melissa said, all of those spaces. And so I would just encourage all of you, if you are not already familiar with a TICian in your area, chances are you have one. And if you do not have one that's close enough to you, you can create one. There's a framework for that, and it's well supported. I know when we in the greater Williamsburg area decided to start one, Melissa was very helpful. All of these individuals were very helpful because it's about relationships. And we all want this work to be embedded throughout Virginia and every single thing that we're doing, because the more we ask these questions and build this empathy, the more we are going to lead to that collective change that we all know that we need to see. So I don't know, Nancy, if you want to say anything before the break, or if we can just say thank you very much, and I'll turn it over to Nancy.
Yeah, thank you. What an excellent presentation, an excellent panel. Again, I'll say if people have more comments or more questions that weren't answered, please feel free to continue to put them in the chat. You can send them to me, you can send them to Ripple, who you'll have information from, and we'll get the information back out to you. So for now, we'll take a break and allow everybody a chance to have some lunch and start back at 1 with the Family First presentation.
Thanks, everyone. Thanks, Rebecca.